From high atop Healthcare Hill in Central Maryland, this is BSN Headline News. Today's top story is Bon Secours Health System expands its partnership with Premier by deploying Premier's enterprise-wide data warehouse and business intelligence platform, PremierConnect. For more than 20 years, Bon Secours Health System and Premier have worked together to drive new levels of clinical and operational performance using Premier supply chain and performance services. Now, BSHSI will use PremierConnect Enterprise to access, integrate, and interpret our clinical, financial, and operational data to produce actionable, predictive, and prescriptive analytics. According to Skip Hubbard, Senior Vice President of Business Intelligence and Performance Improvement, one data point does not yield an insight, and even a set of data doesn't give us the full picture. In order to meaningfully improve the way care is delivered to a patient population, we need our data analytics to make connections that translate into actionable intelligence. The challenge BSHSI and other organizations face as more machines, devices, and multiple technologies continue to be integrated is bringing all these platforms together to exchange information with each other with a holistic approach. Premier creates a picture of all the data an organization is aggregating every second of the day so it can be used effectively to identify problems, create innovative solutions, and find value. PremierConnect Enterprise delivers a cloud-based data warehouse and business intelligence platform integrating big data from disparate systems. Acquisition, standardization, and integration of population health, claims, and other data from electronic health records, insurance databases, supply chain systems, and other sources to give providers trusted, analysis-ready information. Enterprise Insight, operational and population health solutions powered by integrated data to help providers transition to value-based care models, including accountable care organizations. And Transformation Services with dedicated Premier developers, analysts, and other experts that help providers build advanced analytics solutions and establish the operational and technical agility needed to respond to change. When asked to comment on this partnership, BSHSI Chief Medical Officer Dr. Marlon Priest stated, "This partnership is a key step in helping us predict community needs. It is a major part of our strategy to make care more affordable through clinical transformation. We are excited about what this next step with Premier can bring to our providers." Bon Secours Health System and PremierConnect, helping to transform our health delivery. In other news, Bon Secours Good Help ACO has been around for a while now, but getting it up and running is like turning a ship. It's measured and deliberate. But how are we doing today? Well, let's look at the numbers. 64,931 and growing, the number of Good Help ACO beneficiaries or patients. 87%, the number of our beneficiaries that have been assigned to Good Help primary care providers. 14.87%, up from 8.09%. The percentage of annual wellness visits as a percentage of Medicare patients, and 35,000, the number of Medicare fee-for-service beneficiaries who have signed up to use MyChart, Bon Secours Connect Care's free patient portal. And what do we have to show for these increasing numbers? Well, it's really too soon to tell, but we have noticed that hospitalizations, ED visits, and readmissions are trending downward. Bon Secours Good Health ACO. Stay tuned. Finally, flu season is just around the corner and Bon Secours is gearing up for another tough season. The U.S. Centers for Disease Control, the Advisory Committee on Immunization Practices, and the Healthcare Infection Control Practice Advisory Committee recommend that all U.S. healthcare workers get vaccinated annually against influenza. And in its efforts to reduce the spread of flu among patients, residents, and staff, Bon Secours requires all employees, affiliated medical staff, volunteers, and others who work at facilities receive the seasonal flu vaccination. If you choose not to get a flu shot, policy requires that you wear a surgical mask at work during flu season when working at BSHSI patient care facilities. Flu season is generally considered between November 1st and March 31st. You can get all the details on this year's flu season, including the BSHSI flu policy, on IRIS, Bon Secours' internal portal with everything BSHSI. Don't know how to get to IRIS? Well, just open up a browser while connected to the BSHSI network, and if it's not there already, simply type IRIS in the address field and press enter. Now, anyone can get sick from the flu. You can get and give the flu to or from anyone, including patients and coworkers. If you get the flu, you can spread it to others, even if you don't feel sick. By getting vaccinated, you can help protect yourself, your family at home, and also your patients and residents at work from getting the flu. So, watch for details coming to your local system, and don't let the flu get the first punch. Get the shot, not the flu. Well, that's it for this week. Stay tuned to this portal for future up-to-the-minute information on these and other stories on BSN Headline News. I'm Dave Schlachter. Thanks for joining us. BSN Headline News is a production of Bon Secours Productions and is solely responsible for its content.